So today I am going to discuss very important subject, that is biochemistry. So most biochemistry, you will get a question, nutrition with biochemistry. So I am going to discuss applied biochemistry. So this is for the first semester BSc students. So most of the people will have a doubt in biochemistry, they will forget about the chemical reaction and process and all. So first you should know what is biochemistry. Okay, so biochemistry is a study of chemical process within the living organism. So this biochemistry, in the syllabus there are 8 units of biochemistry are there. So biochemistry are little bit harder than the nutrition, but most of the topic you will get in biochemistry. So there are 8 units, so one by one units I am going to discuss. And what are the important questions which will come in your exam, I will tell you. So this is the overall syllabus related to biochemistry. So in a biochemistry there are so many important questions will come in your exam, like carbohydrate. Related to carbohydrate, you can't skip to study the carbohydrates. Carbohydrates, maybe it will come definition, classification and all that you need to explain elaborately, and briefly you need to explain. Maybe you will have a chance to get a 5-mark questions. Okay, then protein, amino acids and all that will also compulsory come in your exam. And the very important, diabetes mellitus, maybe it will come 5-mark questions. Yeah, maybe you will get a 2-mark question related to diabetes mellitus. So this is overall related to biochemistry. Okay, so there are some important topic at that, so you can't skip to study the biochemistry. Definitely you should study to get the good score in your exam. Okay, like an example, like carbohydrate. Carbohydrate you can't skip to study carbohydrate classification and all, and this is a most favorite questions of the university. Carbohydrate, proteins and all, this is very favorite question. Maybe you will get a chance 5-mark questions you will get. Okay, apart from that there are different kind of disease condition also you will get, jaundice you will get. You need to elaborate what is jaundice, what is the classification of the jaundice, and what is the etiology, clinical manifestations and management. And is a very important, diabetes mellitus. Do you know what is diabetes mellitus? Diabetes mellitus, most of the members have knowledge related to what is diabetes mellitus, and we will cover this diabetes mellitus in our entire BSc year. Okay, so what is diabetes mellitus? So maybe you people are having idea like increased blood sugar level. Actually, what is that? Why the blood sugar level will increase? Diabetes mellitus is a condition in which the blood sugar levels will increase. Why? Due to deficiency of the insulin productions, or insulin productions will be there that will not be adequate for our body. So this is related to diabetes mellitus. So increase in blood glucose level. So diabetes mellitus are 2 types. One is type 1 and another one is type 2. Type 1 is also known as the insulin dependent diabetes mellitus. Due to some factors, there will be a deficient of the insulin production or absence of the insulin production, which is known as the type 1 diabetes mellitus, and which may be it can be the genetic, and mostly it used to happen in the young age population. And type 2 diabetes mellitus, insulin productions will be there, but that will not adequate for our body, which will lead to the increased glucose level. So that is known as a type 2 diabetes mellitus. Mostly it will happen in a elderly population, or obese people and all. So they will have a chance to get a type 2 diabetes mellitus. Okay, so like that, these are some important questions you can't skip to study. If you really want to pass the biochemistry, or if you really want to get a good score in your biochemistry, there are some important topics are there you have to study with the nutrition. Okay, so like carbohydrates, protein, fats and all, you can't skip to study definition, classification and all. And there are some disease condition also. Apart from that, there are some different test will come. Maybe 2-mark questions will come. Elaborate the liver function, mention the list out the liver function test, or list out some test related to cardiology. Okay, so these are some common tests that you need to elaborate it. Okay, and it's a very important component that is known as the pH, acid base balance. Maybe you will have a chance to get a 2-mark questions. Elaborate it. What is acid base balance? You need to explain it. What is acid base imbalances and all that you need to study. Okay, so there are some few topics are that if you will study, if you will cover, okay, then you will definitely have a chance to get a good score in your biochemistry. So most of the students will complain, ma'am, that we have a we have a paper back in biochemistry compared to the nutrition. Nutrition is easy, biochemistry is little difficult. It's not about the little difficult. Biochemistry, there are different kind of chemical processes are there. Biochemistry means water. The meaning of biochemistry is the study of chemical process within the living organism. So you have to remember the different kinds of cycle. Okay, so if it's thorough on that cycles and all, then you can easily get a good mark in your subject. So this is all related to biochemistry. And one more important topic, electrophoresis. Electrophoresis also definitely will have a chance to get a 5-mark question related to electrophoresis. Okay, with that, don't study only 5-mark questions or 2-mark questions. Sometimes you need to focus only on 1-mark questions also, because maybe you will have a chance to get a 1 mark question, either fill in the blanks or multiple choice question. So this is all related to biochemistry. If you have any doubt related to biochemistry, or if you have any query related to our syllabus or related to our topic, if you want to know thoroughly about the biochemistry, so everything will be available. You can put your comment in our comment box. I think you all are worried about the biochemistry, what questions will come in your biochemistry. Don't worry, I will tell you the important questions according to the each unit. So I am going to discuss the syllabus. Can you tell me how many units are there in your syllabus? There are 8 units are there in the biochemistry syllabus. So I am going to discuss each by each unit, and in particular unit what are the important questions you will have a chance to get in your exam. So number 1 unit is known as the carbohydrate. Okay, so carbohydrate, maybe you will have a chance to get a definition of the carbohydrate, 5-mark questions you will get, or sometimes maybe you will get a 2-mark questions. So carbohydrate, on the carbohydrate maybe you will get explain definition of the carbohydrate, digestion, absorbance and metabolism of carbohydrate. So that you need to elaborate it. Suppose take it as an example of carbohydrate questions will come. Don't write if the questions will come like digestion, absorbance, elaborated digestion, absorbance and metabolism of carbohydrate, 5-mark questions. If you will write only the digestion, absorbance and metabolism, maybe you will not a good mark, and if you will write briefly also you will not get a good mark. First you need to write the introduction of the carbohydrate, that you need to write. First you need to write the definition of the carbohydrate, then you need to go to the digestion, absorbance and metabolism. Maybe you will get a 5-mark question related to that. Okay, and sometimes also you will have a chance to get a 1 more 5-mark question related to carbohydrate, like example classification of the carbohydrate, and each classification you need to briefly elaborate. I mean, it's not like a lengthy wise, each point you have to cover the classification of the carbohydrate, and under each classification you need to mention the example or sources of the carbohydrates. So apart from that, if any carbohydrate, if any impaired regulation of the carbohydrate, so what are the complications will happen? Maybe you will get a 2-mark questions. Maybe they will put a question, 2-mark questions. What is diabetes mellitus? So that you need to write the definition of the diabetes mellitus. So most of the members I have seen, they will write only the definition of the diabetes mellitus in a 2-line. If you write in a 2-line, from the 2 marks you will not get a full 2 marks. With the definition also, with the definition of the diabetes mellitus, little bit you need to explain it. Okay, like you need to explain what is diabetes mellitus. There are 2 types of diabetes mellitus, type 1 and type 2. Okay, if you will get a 2-mark questions, sometimes you will have a chance to get a 5-mark questions also. If the questions will come 5-mark questions, that then you, with that, what are the things you need to write? What is diabetes mellitus, what is type 1 diabetes mellitus and type 2 diabetes mellitus, like classification, then symptoms of the type 1 and type 2, what are the complication of the diabetes mellitus, and how to do the management of the diabetes mellitus. If 5-mark questions will come, okay, remember it, if 2-mark questions will come, no need to write completely, only you need to write the definition and types. If 5-mark questions will come, this everything you need to write, whatever I told previously. Okay, so that you need to write briefly. Okay, so apart from that, maybe 1-mark questions will come. What are the investigation tests are there in a diabetes mellitus, that you need to write. Sometimes they will put a question, list out the test in a diabetes mellitus, what are the tests we are doing in a diabetes mellitus patient, that you need to write. Okay, Then one more. Maybe you will get a one more questions. Okay. Write the full form of OGTT. You know what is the full form of OGTT? Oral glucose tolerance test. So maybe they will put a questions. Maybe one more question they will tell. Write the full form of OGTT, or maybe they will put the 2 mark questions. What is OGTT? Indication, procedures, and how to interpret the OGTT value, and what is the GTT curve. So that you need to write. Do you know what is oral glucose tolerances? So this is the normal test to identify the glucose level. Normally in this test the patients will be there in a fasting for the 8 hours. After the fasting they will give a 75 gram of glucose. After that, after 1 to 2 hours they will do the glucose test. By that they will identify the glucose level. Okay. So this is all related to the OGTT test that you need to elaborate it. Okay. Then one more important thing, how I told you before that, increased level of the glucose in blood will leads to the diabetes mellitus. Like in the same wise, these all are the carbohydrate related disorder. Okay. So like in the same wise, a decreased level of the glucose in your blood, which is known as what? Hypoglycemia. Okay. So maybe you will have a chance to get a 2 mark questions. Okay. Explain what is hypoglycemia. Okay, mostly you will get 2 mark questions. What is hypoglycemia? That under that you need to write the definition and causes of the hypoglycemia in a short form. Okay, so this is all related to the carbohydrates. Okay, so these all are the important question. Then come to the second unit. Your second unit is in lipid. Okay, so what is lipid? Definition of the lipids. Under the lipids, fatty acid. Okay, fatty acid, definition of the fatty acid, type of fatty acid, essential fatty acid, yeah, non-essential fatty acid, like classification. Okay, so do you know what is essential fatty acid? Essential fatty acid our body is unable to produce. Non-essential fatty acid our body will produce. So that you should know what is the difference between essential and non-essential fatty acid. If these questions will come, fatty acid, definition, classification, and clinical significance of MUFA and FUFA. Do you know what is MUFA and FUFA? MUFA means monounsaturated fatty acid and FUFA means polyunsaturated fatty acid. That you need to elaborate it. Okay, like how in the carbohydrate I already told you digestion, absorbance and metabolism is there. In a lipids also, that also you need to remember digestion, absorbance and metabolism of lipids. So that you need to write. Maybe you will have a chance to get a 5-mark questions. Explain it digestion, absorbance and metabolism of lipids. If like this will come, don't explain only in digestion, absorbance and metabolism. With that you need to write the definition of the lipids also. Okay. So this is one important 5-mark questions you will get from this unit. Okay. Then if any abnormality will be there, lipid related disorders. Okay, so what are the lipid related disorders will come? From the disorders maybe some questions will come. Okay, then with that, what is good cholesterol? What is the other name of the good cholesterol? Good cholesterol is known as the HDL, high density lipoprotein. Maybe they will put 1-mark questions. Okay, what is good cholesterol? What is the other name of the HDL? So like that you need to answer. Good cholesterol, bad cholesterol. So this is all the thing. Okay. Then one more, ketone body. Okay, so ketone body maybe you will get a 2-mark questions. What is ketone body? Name, type and significance. So that you need to write. Okay, so this is all related to lipid. Then come to the lipoproteins. Okay, so maybe you will get, definitely you will get a chance to you will have a chance to get a lipoprotein, type, functions and this everything you need to write the lipoprotein. Okay, and some lipid profiles, what are the common lipid profiles are there, so that maybe 1-mark questions you will get. Okay, so like how I have discussed earlier, in a carbohydrate related disorders, diabetes mellitus will come, hypoglycemia will come. In a lipid disorders also atherosclerosis will come. That will definitely will have a chance to get a 5-mark question related to atherosclerosis. Not only from the carbohydrate lipids parts you have to study, with that also you have to study the disease condition also. So that you should know what is atherosclerosis. Can you tell me what is atherosclerosis? Atherosclerosis is the hardening of the artery due to the deposition of the lipids, fats molecule. That is the atherosclerosis. That you need to write the definition of the atherosclerosis. Okay. Then etiology of the atherosclerosis, clinical manifestations and management. That you need to write. No need to write the pathophysiology. Okay. So that this is all related to the lipids. I hope everyone understood the unit number 2. What are the important questions will come in your exam. Okay. Then come to the next unit, that is known as a unit number 3. That is known as a proteins. Like how the carbohydrate and fats, protein is also very important unit. You can't skip to study the proteins. Okay. So like in the same wise, definition of the proteins, classification. Okay. Amino acids is the molecules of the proteins. Okay. So classification of the amino acids, okay, based on the nutrition, metabolic rate, digestion, absorbance and metabolism of the proteins, and related to disorders. Protein related disorders also you need to write. How is the synthesis of the amino acid, that everything you need to write. Okay. So then with that also you need to, sometimes you will have a chance to get a 5-mark question. Write the inverse errors of the amino acid metabolism. Okay. So that you need to write. Okay. With that also maybe you will get a 2-mark questions. Plasma proteins. Okay. So what is plasma protein? Types of the plasma protein, functions of the plasma protein, and what are the normal value of the plasma proteins. Okay. So if the plasma proteins, if the proteins value will be high, so what it will cause? Proteinuria. Okay. So what is proteinuria? Like how I have discussed earlier, carbohydrate related disorders, lipid related disorders, protein also some disorders are there. Okay. So proteinuria. What is proteinuria? What will happen? Proteins will come in a urine. So that is known as a proteinuria. So when in your blood protein level will be high, that protein will come out through the urine, that is known as a proteinuria. So maybe you will have a chance to get a 2-mark questions. Okay. Then next one is hypoproteinemia. So maybe you will have a chance. Hypoproteinemia. Hypo means what? Decrease. Proteinemia, decrease level of the protein. Mia means what? Blood. So sometimes they will ask you what is hypoproteinemia. No need to confuse between the difference between proteinuria and proteinemia. Proteinuria means proteins will come in a urine. Hypoproteinemia means decreased level of the protein in a blood. Okay. Then one more questions also you will have a chance to get. Hypergammaglobulinemia. So maybe you will get a 2-mark question related to this protein disorders. Only you need to focus on digestion, absorbance and metabolism of protein, classification of the protein and definition of the protein. Okay. Disease condition, maybe you will get a 2-mark questions. Okay. Then one more from the protein, electrophoresis. Electrophoresis, this unit is there in the unit number 3rd. So electrophoresis, maybe you will get a 5-mark question related to electrophoresis. What is electrophoresis? Principles of electrophoresis, normal and abnormal electrophoresis patterns. Okay. In a brief you need to explain. Okay. So remember always 10-mark questions will not come according to the latest syllabus. Only 5-mark questions will come. Okay. You need to cover each and every point briefly. If you write in a lengthy wise means you can't able to cover the entire point. So that you should know how to write properly, so that you will have a chance to get a good scores in your exam. You need to cover the entire point, each and every point. Under each and every point you need to explain it. Not like completely, in a briefly you need to explain. Okay. So this is all up to the unit 3. Okay. So next one is unit 4. Okay. Unit 4 is known as the clinical enzymology. Do you know what is clinical enzymology? Study of the enzyme. Where you will study the enzyme? By the study of enzyme, we will get to know what are the abnormalities are there in our body. So that is known as the clinical enzymology. We will study the enzyme, okay, in a blood, or either in your urine, in various kinds of sample. We will study the enzyme levels. Okay, so this is known as a clinical enzymology. Okay, so that maybe you will have a chance. So there are different kinds of enzymes are there which is used to secrete from the different parts of the, from the different system. Okay, like it as an example, liver disease. If you want to know whether the person is affecting in a liver disease, there are some enzymes are there like ALT, AST, ALP, GGT. So there are some enzymes are there. Maybe you will have a chance to get a write the full form of ALT. Yeah, list out the enzymes which is available in a liver disease. By identify that enzyme, we will able to identify the conditions. Whether the person is affecting in a liver problem or not. Like in the same wise, myocardial infarction, like related to heart. From the myocardium also there are some certain enzymes used to secrete. Okay, so if that enzymes level either will be high or either will be low, the person will be diagnosed in a certain heart condition. Take it as an example of myocardial infarction. Okay, so when a person will be diagnosed as a myocardial infarction like CK, cardiac troponin, AST, LDS, there are some certain enzymes. If that enzymes level will be high, then we will suspect that the patient is having myocardial infarction. So these are some enzymes. These enzymes only will study in this particular unit. Like creatinine kinase, troponin value will be high, LDS, lactic dehydrogenase. So that you need to study. Okay. So what I have discussed? Liver disease. Then heart disease, particularly myocardial infarction. Then come to the muscles. Okay, muscles also there are some different kinds of enzymes which is used to secrete from the muscles. So if that enzymes level will be high, which will cause some disorders in a muscles. Okay, like example, CK, creatinine kinase, aldolase. So these are some enzymes which is used to secrete from the muscles. Okay, then come to the next one, bone. Okay, what are the different kinds of enzymes which is available in the bone? If any abnormality will be there, which will cause bone problem. Okay, so that is known as the ALP. Okay, then one more, come to the next one, prostate gland. Okay, so when you will diagnose the patients with the prostate cancer, there are some specific enzymes are there in which doctors used to suggest to do that test of that particular enzymes. PSA, prostate specific antigen. This is a very important enzymes to diagnose whether the person is having prostate cancers or not. And one more is ACP. Okay, acryl carrier protein. So these all are the things. Okay. So then come to the next unit. So what are the chances you got? 5 mark questions you will have a chance to get carbohydrate, proteins and fats. And clinical enzymology, maybe you will get a 2 mark question. List out the enzymes which is available in a liver, list out the enzymes in a muscles, list out the enzymes in a myocardium or heart. So you will get you will have a chance to get. Okay, then come to the next unit. Next unit is unit 5, acid base imbalance. You will have a chance to get a 5 mark questions. Definition of the pH. Okay, what is the normal value of the pH? Regulation of the blood pH. Okay, so how to regulate the blood pH, like blood before respiratory and what is the role of the respiratory system and renal system to regulate the blood pH, that maybe you will have a chance to get. Okay, then one more important question, ABG. ABG you will have a chance to get a 2 mark questions. Okay, arterial blood gas analysis. What is ABG? What is the normal value of ABG and what are the acid base disorders are there? Type, definition and causes of acid base disorders. Maybe you will have a chance to get a 5 mark question related to this unit. Okay, then come to the next unit, unit number 6, that is known as the Heme catabolism. Okay, so maybe you will have a rarely chance to get related to this unit. Heme degradation pathway, that pathway you need to explain it. Okay, and jaundice. Jaundice definitely you will get 5 mark question related to jaundice. The disease condition you can't skip to study the disease condition. Okay, so jaundice, like type, definition of the jaundice, type, causes, okay, and what are the value, urine and blood investigation are there to identify the jaundice, that we need to remember, okay. Then come to the next unit, unit number 7, okay. So what is unit number 7? There are, what are the tests are there? Organ function test, what different kinds of biochemical tests, different kinds of parameters, normal value and abnormal value, that too definitely you need to remember. Maybe one more questions will come, okay. What are the normal value of that particular test, okay. So related to renal, what are the tests are there? Related to liver, what are the tests are there? What is the normal value, abnormal value? Related to thyroid also, what are the normal tests are there? What is the normal and abnormal value? That you need to write. Maybe you will have a chance to get a 2 mark questions or 1 mark questions, okay. Then come to the last unit, that is known as the immunochemistry, okay. Immunochemistry definitely will have a chance to get a 5 mark questions, okay. You can't skip to study the immunochemistry, okay. So in immunochemistry, what are the things will come? Structures and functions of the immunoglobulin. These same things you will get to know in a microbiology also, in a biochemistry also immunochemistry is there, okay. So structure and functions of the immunoglobulin, what is immunoglobulin, okay, that you need to write. And what are the investigation and interpretation of ELISA. What is ELISA? Enzyme linked immunosurveillance assay. Maybe you will get a 2 mark questions, 1 mark questions, or completely 5 mark questions you will get a definition of the ELISA, how to do the investigation and interpretation of the ELISA, okay. So this is all related to important questions, 5 mark, 2 mark and 1 mark questions. Probably you will have a chance to get related to biochemistry. So no need to study the entire syllabus, okay. I have already discussed the important question. If you are thorough on that particular question, you will have a chance to get a good score in your exam and easily you can able to pass in your biochemistry subject. So this is all related to the important questions in your syllabus. Probably you will have a chance to get. So I am going to discuss some of the important questions which already came in your exam. Okay, so normally you will get a 25 marks, you will get a combined question paper, nutrition and biochemistry, that will be for 3 hours, okay. So 1.5 hours, first you need to do the nutrition, then remaining hours you need to do the biochemistry, okay. No need to worry for the long essay, only you will get a short essay, short questions and some multiple choice question, okay. So this previously came question like how, before that already I told you, explain in details about digestion and absorption of carbohydrate, okay. So if these questions will come, explain in details, if it is a 5 mark questions, already I have discussed, don't write that much, okay. So you need to write the definition of the carbohydrate, then digestion and absorption and metabolism of carbohydrates. You need to briefly explain, minimum 2 pages you need to cover to get a good marks in from the out of 5 marks, okay. More is lipoprotein, okay. So maybe we will before that already questions came, define lipoprotein. So definition of the lipoprotein, explain the functions of the lipoproteins, okay. So already I told you from the unit number 2 you will have a chance to get so 5 mark questions came from the lipoprotein, okay. Then one more important questions also came in your university exam. Define amino acids. Describe the factors that affects the denaturation of the protein. So that maybe you will have a chance to get, and already these questions came in your previous exam, okay. Then next one. So questions already came from the carbohydrate part, from the lipoprotein part and from the amino acids part, from unit 1, unit 2 and unit 3, okay. Then one more. ABG, arterial blood gas, already before that already I told you, this is also maybe very important question, 2 mark questions you will get. Already the questions came, write the normal value of arterial blood gas, that you need to write. What is ABG and what is the normal value of ABG, okay. With that one more questions also came. What is jaundice? Or there are 2 types of jaundice. One is physiological, another one is pathological. So maybe questions will come. What is physiological jaundice? That you need to write. Okay. Then list out the test to check the liver function. So that test, what are the tests are there? taste are there in a liver, so that you need to write. That 2 mark questions already came. Okay, then come to the next one, multiple choice question. Okay, so one more multiple choice question I will discuss. The process of conversion of glucose to glycogen is called what? Options 1, glycolysis, gluconeogenesis, glycogenesis, yeah, glycogenolysis. The process of conversion of the glucose to glycogen. So who can tell me the answers? The answers will be glycogenesis. Genesis means what? Formation. Glyco means what? Glycogen. So formations of the glycogen is known as the glycogenesis. So that is the question, is the process of the conversion of the glucose to glycogen is called what? Like this questions came previously in your exam. Okay, one more question we will discuss, multiple choice question. The enzyme ALT, what is the full form of ALT? Alanine transminase, is also known as what? Options 1, aspirate transminase, gamma glutamic transcriptase, serum glutamate pyruvate transminase, and one more is serum glutamate oxaloacetate. So what is the other name of the ALT? Who know the answer? Please answers below the comment box. Okay, so I am waiting for your answer. If anyone know the answer, answers below the comment box. So what will be the answers? Okay, answers will be the serum glutamate pyruvate transminase. Okay, then example, next example. Okay, an example for the weak acid. Okay, one more questions also. Okay, multiple choice question, an example for the weak acid. Options 1, KOH, second one NaOH, acetic acid, and HCl. So who can tell me what will be the answers of this particular case questions? Acetic acid. Acetic acid is the answers of these questions. Okay, then next questions also came, anaphylaxis. So like this some multiple choice questions will come in your biochemistry subject. Okay, anaphylaxis. What is anaphylaxis? Anaphylaxis is an example of what? Okay, autoimmunity, hypersensitivity, tolerance, yeah, herd immunity. Okay, so maybe you will have a chance to get, already questions came. So what is anaphylaxis? Anaphylaxis is an example of the what? Hypersensitivity. So like this some questions will come, multiple choice question, 1 mark questions, 2 mark questions, and 5 mark questions from the biochemistry subject. Okay, so you will have a chance to get 25 mark questions in your biochemistry. And already I have discussed the important topic, and there are some important unit and questions. If we'll thoroughly study, definitely you will have a chance to get a good mark in your biochemistry exam. Okay, and don't forget to study the nutrition also, because it will come in a combined form, nutrition and biochemistry. So both you have to study. So this carbohydrate, protein, fats and all, already you have a knowledge in your nutrition. You can make it combined and you can study. Apart from that, there are some specific tests are there. You need to remember the normal value and all. Okay, so this is all related to the biochemistry. Mostly 25 marks you will have a chance to get. Okay, so I hope everyone understood what are the important points, what are the important questions which will come in your exam. So if you study only that questions also, you can easily able to pass in your biochemistry subject. I don't want not only you need to pass, with that also you need to get a good marks in your biochemistry. Thank you.